Welcome back, guys. I hope you are all doing well. So today's my topic of discussion is about the temporal lobe, its first part, and its explanation and clinical importance related to that. What are the name of that part? First part of the temporal lobe. If I talk about the cortex of the temporal lobe, the primary auditory cortex. Okay, the primary auditory cortex. First I draw the diagram and show you the primary auditory cortex, and then explain about its pathway related to it, and also explain the lesions related to it, the damage related to it, and what type of lesion and what type of damage related to it, and what type of clinical feature appear in the patient. Okay, so first I draw the structure. This is our brain. This is central sulcus, this is parieto-occipital sulcus, this is lateral sulcus. Just inferior to the lateral sulcus, there is an area which is called primary auditory cortex. Okay, which is called primary auditory cortex. Now today's my topic of discussion is this area. Okay, so I have to explain you this area in the coronal section. Okay, I have to draw the coronal section at the level of the temporal lobe, and I explain it in detail. So first I draw the picture. This is cerebellum. This is your spinal cord. This is brainstem. Okay, so this is the coronal section of the brain at the level of the temporal lobe. What is this, guys? This is the lateral sulcus, and here is temporal lobe. This is temporal lobe. Okay, so the first area of the temporal lobe, what are the area? I have to highlight it. Here is this area. What are the name of this area in parrot color? This is primary auditory cortex. Okay, what are the function of it? Its function is conscious awareness of any voice. Conscious awareness, you have to aware from the voice. For example, I talk in video and you have to hear it. Okay, and you have to aware it, my voice frequency, pitch and localization. Okay, like this type of awareness. Okay, so all these frequency, pitch and localization are controlled by primary auditory cortex. Okay, so now I draw some pathway related to primary auditory cortex. Here I draw the ears. Okay, this is your ear, right ear and left ear. Okay, this is your brain stem. Brain stem. Now I have to draw the pathway related to it. I have to draw in red. Okay, from the inner ear. Okay, this is the right side and this is the left side. From the inner ear, the information sends towards the which part of the brain? The brain stem. Okay, in the brain stem there is a nucleus which is the vestibular nucleus. So neurons synapse with the connect with the vestibule nucleus and cross to the opposite side in the brain stem and move upward. From the right side, the axon move towards the left side in the brainstem, and from the left axon move towards the right side axon. Okay, and now here is another structure which is thalamus, the relay center of the brain. So now this neuron relay on this thalamus. What are the nucleus name of the thalamus where these neurons are relay? I draw in blue color. What are the name of this nucleus? This is medial geniculate nucleus. Okay, medial geniculate nucleus. So from here the axon travels towards the primary auditory cortex, okay, of the opposite side. Okay guys, so this is the pathway. The information for, okay, I have to follow one pathway. I have to draw and label it. The information goes from this area upward, right ear, in the brainstem, the vestibular nucleus synapse. It synapse in the brainstem to the vestibular nucleus, and then information cross to the opposite side and move upward towards the thalamus and to the primary auditory cortex. Okay, this is the pathway. This is the right side, and this is the right side, and this is the left side. Okay, for example, right ear of your right ear is controlled by which area of the your brain? Left side of the primary auditory cortex. And the left ear of your body is controlled by which area of the brain? The left ear, right primary auditory cortex. Okay, opposite control. Okay, so these are the pathway related to it. Okay, so what are the importance of this pathway? The importance is when there is any damage. For example, I explain a little bit about clinical importance. I have to draw a line here. Okay, I have to draw a line here and tell you the clinical importance related to it. Okay, clinical. Okay, clinical. So what are the importance? Any damage to the to this area. Okay, I have to draw in blue this area. Okay, primary auditory cortex. Any damage to the pathway of receiving the information related to frequency, pitch and localization. Any damage to this pathway. Okay, above this line, above the vestibular nucleus which is present over here. Okay, vestibular, you know guys, the vestibulocochlear nerve. What are the number of the this nerve in the cranial nerve? It's a cranial nerve 8, vestibulocochlear nerve. Okay, so this is the green nucleus are the vestibular cochlear nucleus. Okay, so any damage above this nucleus, what type of clinical feature appear in the patient? Okay, the damage is on the right side of the area above the vestibulocochlear nucleus. The features on the left ear is shown in the patient. The frequency, the pitch, the localization of the opposite side is affected in that patient. For example, I give you some practical example. For example, my part of the brain which is the temporal lobe, primary auditory cortex, is damaged to this side. Okay, and I cannot hear properly from this ear. What type of sensation? The frequency, pitch and localization of voice. Okay, normally I understand the localization of voice. The voices come from right side or from the left side. The voice is high pitch or low pitch. What type of voice it is? Okay, any voice. Okay, so if there is damage to the area of the brain which is primary auditory cortex, either it is right or either it is left. Okay, so the opposite here is loss. Okay, if there is damage to the right side, the left side is loss, hearing frequency, pitch and localization is lost. And when there is damage to the left side of the primary auditory cortex, the opposite, hearing, auditory and localization are lost. Okay, so this is the clinical importance related to this primary auditory cortex, which function is conscious awareness of the voice. So guys, I hope you understand my video. Please like, subscribe and share it, and please spread the knowledge. Okay, and press the bell icon for receive any new video. So guys, I hope you understand. So please kindly made the proper notes of these videos and learn it. Okay, so goodbye guys.